now do the 360. So I will now start. Prior to entering the patient's room, I'm gonna do the hand rub. Hi, good morning. How are you today?
I'm good.
My name is Glory Morella. I am your nurse and I review your chart and the doctor's order for a wound dressing change. Is that okay with you?
Yeah, sure.
This may take about 10 minutes of your time, okay? So can I check your armband? What is your complete name?
Ivy Retotar.
And your date of birth?
10/30/97.
Okay, perfect. So I will just close the curtain to provide privacy, okay? So Ivy, are you in pain right now?
A little bit.
Can you rate it on a scale of 0 as no pain and 10 as severe pain?
2?
Do you want any pain medication before we start?
No, thank you.
Okay, so do you have any allergies?
None.
Okay, let me just prepare the things that I will be needing in changing your wound dressing, okay? Thank you. I'm gonna do the hand rub. So, gonna get the underpad. Then the sterile solution, as well as the measuring tool and the tape. Gonna do the hand rub again. And now I will be opening the sterile wound kit. I will make sure to touch it on the edge at around 1 inch border and open it away from me. Then on the side and on the other side. And here, there is a pick-up forceps here, which is I will be using it to manipulate the sterile field. Okay. So let me just remove the cover. And I have 4x4 sterile pad here, as well as 6 2x2 gauze. Gonna put the pick-up forceps on the middle. And for the meantime, gonna put the pick-up forceps here at the edge of the sterile field around 2 centimeters away. Gonna pour some solution and make it sure I did not spill it here to avoid contaminating it. Okay, so let me do the hand rub and wear my gloves. So I will make sure that my patient is on her comfortable position. So Ivy, are you in your comfortable position right now?
Yes.
Do you feel any pain before we proceed?
No.
Okay, so no need for pain medication. Okay, so can you put your arm here? So my patient wound is on her left anterior arm. Can I open it now?
Sure.
Okay. So the dressing has serous discharge as well as the wound. Okay. So let me just measure it. And the length of the wound is 10 centimeters and well approximated. There is mild edema upon palpation and there is erythema and the wound is closed and no overlapping. Okay, so let me just remove my gloves, do hand rub, and wear a new clean gloves. So gonna get the 2 pick-up forceps here and get the 2x2 gauze. And I will going to soak it on the solution. And I will be cleaning from the least contaminated area to the most contaminated with the head to toe direction. I'll begin it on the midline. So I will be doing the same procedure at the both side. Okay, with head to toe direction. Okay, so I will pat it dry. I'll begin at the midline. On the side, with the same procedure, head to toe direction. Now, I'll be getting my 4x4 sterile pad to cover the wound, and I will make sure to cover it all. Okay. So, I will put the two pickup forceps here at the edge of the sterile field about 2 centimeters away. I will be using my tape to secure the wound dressing. And I will write the date and time today. Okay, so Ivy, how are you feeling now?
I'm good.
Do you have any pain during the procedure?
No.
And about now? No?
No.
Okay, so no need for pain medication. Okay, so I will place my patient into her comfortable position. So I will put your bed in its lowest position and the call bell is here. Okay, if you have any questions or concerns, just feel free to push it and I will come. Okay?
Thank you.
So I will do the aftercare. I'll now remove my gloves and do the hand washing, and I am now going to the nurse's station to do the documentation. Okay? So for the documentation, my patient wound is on her left anterior arm. The dressing and the wound has serous discharge. The length of the wound is 10 centimeters. It is well approximated. It is close and no overlapping. There is an erythema and mild edema during palpation. She has a pain scale of 2 and she well tolerated the procedure. That's it. Thank you. Okay, so let me do the 360 again.